So it's always a pleasure to come out here in January. I'm from Boston, and so I always like to come out here. This is actually my fourth time coming here. So I am the co-founder of Glint Pharmaceuticals, and what we are doing is developing a drug delivery contact lens to treat eye disease. So if I leave you with anything today, it should be this. We have a platform technology, and we're taking approved contact lenses off the shelf, combining them through a patented process that we own, combining them with approved drugs to create new products for various diseases, glaucoma, AMD, dry eye, and some rare diseases, and I'll talk about that as well. So this is the take-home message for you today. So as I mentioned, we're developing this platform technology. We have an extensive patent portfolio covering the technology, the initial markets I mentioned before, and we have clinical trials, studies ongoing for glaucoma. We've actually completed a phase 1 study. We have strong relationships with patient groups, and we're raising financing for product launch in 2020. This is the core team of the company. Myself, I've developed in conjunction with an ophthalmologist some years ago a technology to treat corneal infection. That technology is now the #1 treatment for corneal infection in the world. My colleague, Dr. Chauhan, is the inventor of the technology I'm going to talk about today. And then we have a veteran from J&J contact lens business who was there for over 30 years. So this is how the technology works. A little background. So you have your cornea, you have the tear film over the cornea, and then you have the various ducts and anatomy. So essentially what we are doing is taking a contact lens, placing it over the cornea, and allowing the contact lens to slowly, in an engineered and programmed fashion, release drug over the cornea directly. So typically, if you had a contact lens and you soaked it in drug, what would happen is the drug would go in, and then essentially it would just fall out immediately. Within a minute or 2 minutes, you get a burst effect, and the drug would be gone. Whereas in our technology, we place barriers, and these barriers are a version of vitamin E. And now, when you have the drug going through, it has to transit all those barriers. So the fewer barriers you have, the faster the drug comes out. The more barriers you have, the slower the drug comes out. And we can program this to release drug over 2 hours or over 20 days. And so as I mentioned, and on the right-hand side, you have a scanning electron micrograph of the porous nature of the contact lens. And in these pores, we instill vitamin E. The vitamin E sets up, and then we put drug in there, and the drug gets trapped. Once you put it on the eye, it slowly starts to come out of the contact lens and elutes onto the cornea. So these are some of the markets that we're going after. We have the antibiotic market. We have glaucoma. The glaucoma product is currently undergoing phase 1 clinical studies, and I'll talk about those in a little bit. We have cystinosis. Cystinosis is a rare disease affecting about 500 people in the United States, and it's one of my favorite antidotes for this technology. Cystinosis is a disease that affects the cornea, and it builds up corneal crystals because you can't metabolize cysteine. And after a while, you go blind. So what these patients do is they take a drop of cysteamine, which is an approved drug, and put it on the eye, and it clears up the corneal crystals. Now the rub is, that sounds right, the rub is the prescribed regimen for taking this medicine is a drop of cysteamine every hour, every day, for the rest of your life, starting at age 2. These people tend to live to 50 or 60 years old. It used to be 30 years old before the drug. 100% of these people will get a kidney transplant sometime in their lifetime. So how many people do you think stick to that regimen of eye drops every day? 0, right? Exactly. So with our technology, the patient would put the lens on in the morning and go about their business. They're done. So that's one of my favorite. And then, of course, the markets are post-surgical pain, and then everybody's favorite, dry eye. So our first product is going after corneal ulcers. Corneal ulcers are caused by an infection of the eye. And when you present at your doctor's office with a corneal ulcer, all the bells and alarms go off. Because if it's not treated properly, within 24 to 36 hours, you will lose your eye. You could lose your eye. Done. End of story. And so the regimen now is you take a drop every hour for 36 to 48 hours, and you would go back to the doctor and have them see it. With our technology, you would take the lens out of the package, put it on the patient's eye, and send them home. And you would come back one time, once a day for the next 4 days to get it checked out. If the infection hasn't been reduced, you put another lens on. If it hasn't been reduced after 3 days, you put another lens on, and so on and so forth. As opposed to fighting with drops every hour for that 4 to 5 day period. So we've done proof of principle studies, and this is with the antibiotic in an in vitro setting. And as you can just see, on the left-hand side is no treatment. On the right-hand side is treatment with our lens. So we reduced the infection significantly. We kill bugs with our lens. That's the take-home message on this slide. So everybody has their baby pictures. So this is our first lens that we made last week with moxifloxacin, which is a broad-spectrum antibiotic. So I like to show this. We're for real. Our product pipeline in the infectious disease area starts with the corneal ulcer lens. Corneal ulcers are also caused by viral infections, so we have a viral lens, and then we have different types of antibacterial lenses that we can manufacture. So we have a pretty broad pipeline, even in infectious diseases. If we were only to do just infectious diseases, we could be very, very happy company. So we have a regulatory pathway that gets us into the marketplace. We expect to be into the marketplace with our infectious disease lens by end of the second quarter of this year. Done. So we've done this all with out-of-pocket funding from the founders, no outside capital. We have a nice reimbursement pathway. We have one of the leading reimbursement specialists in the country working with us, and the reimbursement codes are already in place. We've talked to ophthalmologists who think that every ophthalmologist in the country should have at least 2 lenses on their shelf at all times. And of course, you just multiply this worldwide. We've done glaucoma studies, as I mentioned before. 10 patients have been studied. We've reported no adverse events, and we've seen significant benefit with our lens on those patients. So here, I'm just showing, so the lens is on the eye for 2 days with drug. We then remove the lens, and then we measure intraocular pressure, which causes blindness eventually, if it increases too much. We measure intraocular pressure for up to 9 days. And the significance of this slide is that when we took the drug away from the patient's eye, their intraocular pressure stayed low for up to 9 days, no drug. So the implication is for people who are taking drops and multiple drops every day in their life for glaucoma, they could put the lens on Monday, take it off on Tuesday morning, and not have to put it back on until the next Monday. Done. And because it's not an implant, if there are any side effects, you just take the lens out and go about your business. So it's very exciting. So our milestones, as I mentioned, and I put the one in bold, which is the most important one. We're going to be launching our product within 6 months from today. These are the comparables. Every good company should have them. All these companies are worth a lot of money. We think our company is in the same company. So in summary, we have a drug delivery contact lens technology that is a platform. It goes all the way from the clinical markets to the consumer markets for dry, for example. We're going to be launching our first product in the bacterial ulcer market within 6 months of this year. We have a good fast-track regulatory pathway. Reimbursement process is in place. The technology is protected by issued U.S. patents. We have good relationships with patient groups across the world, and we are looking for partners and financing to bring these things to market in 2020.